And if I'm being candid, it was because my grandfather was a physician, my mother is a physician, and my father was a surgeon and a physician, and my uncle's a physician. So, when I was born, it was, we know what you're doing. One of the aspects that makes Johns Hopkins so effective in what they do is that they never compromise on quality, and they breed through and through a sense of professionalism. And there's always that strive, and I think this is perhaps the most important aspect, there's always that strive to improve. Even though we have been able to manage to acquire a certain status and a certain threshold of success, we are never comfortable with that. There's always a push to be better, and it's not a candid push, it's a very, very serious push. Disaster management is a topic that has been around since caveman times. It's a topic of concerns since humans first started, on this earth. So the question is, what makes what we do here today and every day, other organizations as part of Johns Hopkins, now over here in Karbala and Najaf, what is it that we do here that's different? Well, just like everything else, when it comes to experience and logic, it's, there's something to be said about respecting it, and there's something to be said about honoring it. But at the end of the day, what is even more powerful is a consolidated effort of bringing all that experience and logic together into one place. And there's another name for it, and that's research. And so what we do here today is disaster management that is essentially evidence-based. So every organization in cities and hospitals and cities and so on and so forth that you will go to in countries, they will have disaster management programs. But the question is it evidence-based science? So what we've been able to do over here is we have been able to bring evidence-based disaster management principles, and we have been able to convey them to the folks who have very little resources. And we have been able to do it in such a way that they can now implement some very highly effective techniques at coordinating and deploying resources that they otherwise may not have been able to do. And with that disaster management, under the umbrella of disaster management, we've also taught them some simple yet very effective pre-hospital management of traumatic hemorrhages. Disaster management is a very essential component. I would say it is the essential component for a country like Iraq, which is war-torn. And with the lack of infrastructure, with a lack of systems in place, you need to have some sort of a plan where you have the ability, where you're empowered to bring order out of chaos. And that's what disaster management does. It allows you to use whatever resources you have, regardless of the limitations that you have, and implement plans that make the best use of resources. Is the most efficient and the best way to deploy and coordinate efforts. We had students, medical students, who were playing as the actors. They were screaming. I mean, some of them should really win the Oscars, and they had labels on them identifying what sort of injuries they had. And essentially, we gauged the triage methodology of the folks that were playing this exercise, and then we also gauged how effectively they implemented on-field treatments, such as stopping traumatic hemorrhages, and such as implementing proper effective triage methods. And then of course we gauged on whether or not they were able to keep an eye on very important developments that could happen in real life, such as safety issues, media issues, operational issues such as access to resources. And lo and behold, we found a lot of room for opportunity, for improvement. And it was great to see that the responders that came, the medical students, the Ataba folks, they were all very enthusiastic. When you teach any subject in which there is a lot of science behind it, in which there's a lot of years of sophisticated logic and thinking behind it, it's very easy to be tempted into explaining it in complicated terms. It's actually very difficult to translate what you know into the simplest way. And it was a challenge, but we were able to do it. We were able to teach something that's usually taught to clinical professionals or very high-level leadership folks in healthcare and other industries, to folks who did not meet those requirements. And the proof of whether or not they understood the material were the intelligent questions they asked. So there was enthusiasm, they were receptive, and like I said, they had gone back and they shared information with their friends, because the follow-up groups we had, they magically knew some of the answers that we had discussed before. But I encouraged that and I applauded them for that, because that's the point. The point is for folks to go back and to share this information and to disseminate it. So they were already engaged and people were already sharing information, and to the point that they were so enthusiastic that they nudged their leadership, and their leadership absolutely were supporting them, where they were able to now, that we have found out, dedicated a space and timing and plans to actually do these drills. Yes and no. So ambitious people, I would say, fortunately and unfortunately, I may be one of them, are never satisfied. So we always want to do more, and I think that's what drives us to continue doing our efforts and continue sticking with what we are trying to do, and continue driving home the ultimate goals that we have in mind. But if I was, cut myself some slack and be realistic about the objectives that I did set out to meet, alhamdulillah, we were able to meet them. So the objectives specifically were, to convey to the frontline workers as well as to the medical students disaster management principles, specifically the principles of incident command systems. They were able to understand that, and they were able to deploy that into drills. To be able to convey to them the latest protocols in triage, specifically solve triage method, because that's relatively easier. And again, they were able to implement that. And then to be able to teach them how to manage on-field traumatic hemorrhages with very limited material. And again, alhamdulillah, we were able to accomplish that.